Hi, and welcome to this 8-part series all about sports taping. This is a fun, new and exciting series to teach you all the ins and outs about taping. My name is Simon Woodhouse, physiotherapist and exercise sports scientist. Taping has been used for many centuries, not only in the sporting field, but also in the clinic by many health professionals. Today, I'm going to teach you all about the guidelines, the precautions, as well as many different taping techniques to be used all throughout the body. To start with, let's talk about the purpose of taping. So what is the purpose of taping? Taping can be used to prevent undesired and unwanted movement. It can also be used to prevent harmful ranges of motion that can lead to injury. It can be used to protect a joint or muscle following an injury. It can also be used to biomechanically help align the kinetic chain to help the body work in its natural way. Before we start taping, there are many different precautions or contraindications that you should be aware of before you start applying tape to your patients or to yourself. First of all, is that some people are allergic to the tape. The use of a hyperallergenic underlay can be very beneficial in preventing people breaking out in rashes, redness or swelling following the use of taping. However, some people are still allergic to this tape and taping should not be used on these individuals. There are other contraindications as well. These include people with an open wound, with poor circulation, or with any nerve damage. Taping should be used with precautions or avoided on some of these individuals. The first tape is a 38mm sports tape. This is the most commonly used tape. It is used for most joints and muscle injuries throughout the body. It is very adaptable and also provides a great deal of support. The second tape is a 25mm rigid sports tape. Exactly the same properties as the 38mm, just a little bit smaller. Therefore, it is more useful for injuries of the thumb, wrist or fingers. The third tape is a stretch tape. This is used great for anchors as well as overwrapping. The fourth tape is an elastic adhesive bandage. This is again great for sports. It allows movement, however still provides support for the joints and muscles you're trying to protect. The fifth tape is a hyperallergenic underlay. This has less reactions to the body's skin and therefore can be used under other types of tape. The last type of tape I'll be dealing with today is kinesio tape. This is a new and exciting type of taping technique which can be used for many different techniques throughout the body. It is also very handy to have in your kit a pair of tape scissors. Tape scissors are very useful as they have one blunt edge so you don't cut the skin. Also, it's important to have alcohol wipes to wipe down the skin and make sure it is nice and clean before taping. It is also useful if you're doing a lot of taping to have a shaver or razor nearby to make sure that the skin is hair-free to allow the tape to stick better.